Hello and welcome to the Art of Being Human. As you know, we've been working with chronic illnesses, and these are illnesses that do not leave you. You have them and you have them for the rest of your life. Now, they're treatable. Some of them are fatal, some of them are not fatal, but they are definitely treatable. And so it's important that we understand what they are because they affect us so much. And there is an area that's called physiological psychology, in which the psychologist studies various illnesses and how they affect the brain and the brain functioning. So today I want to start with cerebral palsy. It's an illness that's not genetic. You do not inherit it. It doesn't come from your genes or anything like that, but it's due to a brain injury. And the brain injury that you sustain, if you have it, you got it while you were in the uterus, or you got it in the birth process, or you got it shortly after birth. So it's all connected with the birth process and something that went wrong, or something that happened in the uterus just before you were born, and that's where you get it. And the thing about cerebral palsy is that when you have it, wherever the damage is, you're going to have it for the rest of your life, just like in any other chronic illness. But it's not going to get any worse. It is what it is. The damage is what it is. It happened and that stays that way. Unfortunately, it will never even get any better. So whatever the damage is, it stays, and you have to live with it for the rest of your life, but it doesn't get worse and it doesn't get better. You know, I have a concern sometimes with birthing places where people go to birthing units to have their babies because they want an all-natural process. But what happens in an all-natural process if the baby should have damage, or if the baby should get stuck in the birth canal and they can't move forward, and there they are in the birth canal trying to give birth, and the mother's trying to give birth, and they get stuck because their shoulders are too big or something went wrong in the birth process? Is there any way to take care of an emergency in a birthing center? Is there anything for pain control in a birthing center? Or do they have to call in an ambulance, get you to the hospital, have the doctors do whatever they have to do to try to take care of the situation, when if you were in the hospital to begin with, all of the staff members would be watching you, the baby's progress would be monitored as you go through the birthing process, you would be monitored, and if anything goes wrong, it's immediately picked up, it's immediately monitored, the staff is right there, they can give you whatever you need, and if it requires surgery, such as a cesarean section, they can just go in right there and take the baby out, rather than being in a place where they have to call in a staff or they have to send you to the hospital for that. So what I would think would be usually what would happen in a birth injury is that as the baby is going through the birth canal, for some reason, they can't get oxygen into their brain. They either get stuck or something happens and they don't get oxygen to the brain. And it only takes a few minutes without oxygen to the brain and the nerve cells die and damage is done. And then the baby is born, and what do they have? Cerebral palsy. This would be an example of how a person would get it. So the patients don't get worse, they don't get better, they stay the same. Now there was a study, I want to bring this up, about a man who was born and they thought he was stillborn. When this baby, was a male baby, he was born and they thought he was dead. They didn't think he could breathe. So they put him on a table and just let him sit on a table, lay on a table, and then they took all their attention to treat the mother. So the baby did not have any oxygen to his brain for 18 minutes. After the mother was stabilized, they went back to the baby and worked on the baby, and the baby lived, and that was a surprise to them. They thought he was dead when he was born, but he wasn't, and he was just laying there on a table without getting adequate oxygen to his brain for 18 minutes while they worked on the mother, and then they ended up by working with him. So he has, as a result of that, cerebral palsy. Now, is kind of a miracle case because he's not as disabled as you would think he would be. He can walk. Now, his gait isn't normal. It's not a normal kind of walking, but he can walk without crutches. He can actually ride a bike without using training wheels, and that you would not think he would be able to do either, but he does. And he was able to get married, and I think he had 4 children, and they're all adults now, and they're all normal, no problems with them. And then he is able to talk, and his brain is good and clear. What he talks about, he gives speeches. He gives about 200 speeches a year, so he's really doing incredibly well, considering that he didn't have oxygen in his brain for 18 minutes. But at any rate, he talks about what it's like to be disabled, how can you overcome, how God can help you to overcome, and this is the kind of ministry that he has. So he actually is doing very, very well. So this is part of the story of cerebral palsy. Now, cerebral palsy is, if you're born with it, it's a neuromuscular disability caused by injury, as I said before, to the developing brain before birth. Or it can be an injury to the brain during the birth process, or shortly after the birth process. The usual cause is going to be lack of oxygen to the brain during the birth process. And I've mentioned before, a baby who gets stuck because his shoulders are too big or something like that. Also, if the mother has been exposed to alcohol or drugs during her pregnancy, it can damage the nervous system before birth. German measles can damage the nervous system, the central nervous system before birth, and the brain can really be damaged by that. You can get deafness and you can get blindness and all of that due to damage to the nervous system. Smoking decreases blood and causes a lack of oxygen even for a few minutes to the brain. So smoking damages blood vessels. The thing is about smoking, if you are pregnant, you should not smoke at all. It really damages blood vessels and nerve vessels. Now, the symptoms of cerebral palsy are these. The voluntary muscles don't work right, or the person is paralyzed. There are speech problems. 50% have seizures. 50% have a certain amount of retardation. 1/3 have deafness. And also, a certain percentage of patients will have visual problems. And as I said before, cerebral palsy does not get worse. It's not progressive in that way, but it also does not get better. Wherever the brain damage occurs, wherever the damage occurs in the body pre-birth, it occurs in the part of the body that was developing the fastest. It's interesting when you talk about the development of a baby before birth. There will be certain organs that will take a few weeks and they will develop the most. Then that recedes and another set of organs will develop fastest. Then that recedes and another organ will develop the fastest. So there are periods of time during pregnancy when one part of the fetus develops faster than the others, then that lets loose and another part of the body proceeds and develops faster. Whatever part of the body is developing the fastest, that's the part of the body that's going to sustain the damage if there's going to be damage. And unfortunately with cerebral palsy, it can be the brain, it can be deafness, it can be retardation, it can be muscle problems. The whole body can be affected, but it's basically going to be the part of the body that's growing the fastest. German measles and mumps are very serious for a pregnant woman during certain parts of her pregnancy, because what is going to happen is that the mother may kind of sail through the German measles. I mean, it's uncomfortable, but you can live with it. And the mumps the same way, but it's doing a great deal of harm to a developing fetus. But where is the harm? Well, after birth, you would know the baby's paralyzed, or he's retarded, or he's never going to be able to walk, or he's never going to be able to see right or move right, and that's going to be a problem. So that's what I wanted to tell you about cerebral palsy. It's a very difficult illness for a mother to have because of what happens to the baby, the mumps and the measles and so forth. And of course, during the birth, the problem's going to be getting oxygen to the brain. After birth, like that man, it was 18 minutes before he got any oxygen to the brain, and he suffered a lot from it, but he was able to overcome a lot too. So that's an illness that is not it's a chronic illness, but it's not caused by any kind of an inheriting thing. You just get it during the birth process. Now, the next illness I want to discuss is called Buerger's disease. Now, I'm going to spell this because it doesn't spell like most burgers would. It's B-U-E-R-G-E-R apostrophe S. B-U-E-R-G-E-R apostrophe S. Buerger's disease. This disease is caused by smoking. And it's not anything you pick up before your birth. It happens during your lifetime, but it happens because of smoking. And nobody knows exactly what the process is to get Buerger's disease, and it hits many men, but it doesn't hit very many women. And even the men that it hits, it's considered to be kind of rare. Not very many people get it. But the problem is, if you get it, it's done by smoking. If you do not smoke, you will not get this disease. It is one disease that we can say for sure is caused by smoking, even though we do not know what the mechanism is due to the smoking that causes the disease. So what happens is there is an obstruction of small blood vessels and medium-sized blood vessels. And you have to understand that what smoking does is it damages blood vessels. When I go to the doctor and I have heart problems and I have diabetes, one of the things they always ask me without fail is, do I smoke? No, I don't smoke. I've never smoked a cigarette in my life. And as a result of not smoking, my blood vessels have maintained a kind of health that most people don't have if they're in their if they've had diabetes for 30 years or so, and I have. I've had it for that long a time. My blood vessels are pretty good, but it's because I've never smoked. Now, the symptoms of it is that when you damage the blood vessels by smoking, it develops gradually. It starts at the fingertips and the toes, and the peripheral organs, the toes and the hands, and then it kind of creeps up gradually. It starts early, and then it works up to the arms and the legs. And what happens is that the blood vessels narrow, and then they close off, and there's no circulation. And and as I say, you don't get it early, and it does progress gradually, but when you do get it, there's quite a bit of pain involved, and at some point, the circulation to your hands and your legs, your feet, your fingers, your arms will stop, and you will not have circulation in those limbs. And when that happens, you turn black, because of the fact that there is no circulation. Without blood, you do not get nutrients and you do not get oxygen. Without nutrients and oxygen to your cells, the cells cannot survive. When they start to die, they get necrotic, they turn black, and then after that, with no circulation, you have to have amputations, and that's the way that the illness goes. So the symptoms, and I'm going to kind of review this, it develops gradually, starts at the fingertips and the toes, and then works up the arms and the legs, eventually causing gangrene, and then people feel cold, numb, tingling, and burning. And some people have Raynaud's disease. Now, Raynaud's disease, which is kind of like it, is a circulatory problem. And what happens is that your fingers turn white. Like, I've seen this happen with people. they feel cold, they feel miserable, they feel sore, and the fingers turn white because they're not getting the blood in them. And so they rub their fingers and try to get the circulation going, and then after a period of time, it returns. Now, this gets to be a royal pain. I had one of my friends who was a teacher. She taught English, and every so often her hands would be white. Now, I don't know if she was a smoker. I never saw her smoke, so there may be other ways to get it. But at any rate, the tingling of her hands and the coldness and so forth, it was hard for her to deal with, and that was Raynaud's, and that sometimes goes along with the Berger's disease. You start getting muscle cramps in the arches of your feet and your legs. Once in a while your hands, but not as frequently. And the obstruction gets worse and worse, and the pain gets worse and worse, and it lasts longer. You know, women typically don't get it, but I know a woman who has it. And so it's not unheard of that a woman gets it. It's more prevalent in men than it is in women. Then you have ulcers and gangrene that appear early in the hands and the feet. And the hands and the feet feel cold, and then they become ulcered. And you get sweating, a lot of sweating, and your hands and your feet can turn blue. The nerves are reacting to severe and persistent pain, and you get a bluish color. Now, 50% of people that have it have a weak pulse. Hands and fingers and feet and toes are pale when they're raised above the head, but then they become red when they're lowered. This is not normal circulation, and people develop skin ulcers and gangrene and funguses in their toes and in their fingers. They have a severe decrease in blood pressure and blood flow in the hands, feet, toes, and fingers. So what is the treatment of getting rid of Berger's disease? Well, you really don't get rid of it, but it is treatable. You have to stop smoking. That's the thing that you have to do, because it's progressive in the sense that it's going to get worse and worse. You have to stop smoking, and eventually the patient, if it progresses, gets to gangrene, and then after that you start cutting off. You start amputating feet, legs, fingers and toes. You need to, if you have it, avoid exposure to the cold, avoid injuries from heat or cold, avoid injuries from poorly fitting shoes, because that's a no-no. It will cause a problem in blood flow, or foot surgeries, fungal infections, drugs that narrow the blood vessels. You have to keep yourself warm. That's what you have to do in order to have any kind of relief. And the most important thing is, of course, to stop smoking. Now, tobacco, I just want to get to smoking and tobacco. And there are over 4,000 chemicals in tobacco, and they include acetone, arsenic, benzene, cadmium, chlorine, formaldehyde, propylene glycol, ammonia, carbon monoxide, nitrogen sulfide, hydrogen sulfide, phenol, acrolein. Now, that's not everything. I'm just giving you a partial list. And those destroy blood vessels, and they give heart trouble and lung trouble to individuals who smoke. Now, the harmful effects of smoking tobacco, you get lung cancer, mouth, lip, and throat cancer, bronchitis, emphysema, coronary heart disease, artery damage, damages to the arteries of the legs, neuropathy, damages to the arteries of the brain, which can give you strokes. Smoking during pregnancy is really bad because the babies are less likely to survive. They're less likely to get the oxygen they need to develop. They will get asthma, respiratory illnesses, and the blood pressure will be higher. Nicotine is a substance in tobacco, and it causes addiction to tobacco. Nicotine acts as a tranquilizer. It settles things down, and it causes norepinephrine to go into the bloodstream. It causes blood pressure to rise. Now this part here is important for you to remember. Carbon monoxide will go from the lungs into the bloodstream, and that interferes with oxygen getting into the tissues, and it causes hardening of the arteries, and that's caused, of course, by smoking. The chemicals in cigarettes increase the activity of liver enzyme, and it makes painkillers less effective. Now, the benefits of quitting smoking, I know we're getting out of time here. The blood pressure is more normal in 20 minutes. Heart attack risk drops in 24 hours. Breathing and lung capacity is better in 3 days. Circulation is better in 2 weeks to 3 months. The withdrawal symptoms are tough because it's very hard to stop smoking if you are addicted to it, because it is a drug. You will have craving, irritability, anger, frustration, anxiety, lack of concentration, restlessness, slow heart rate, increased appetite, weight gain, tremor, headaches, insomnia. Withdrawal begins usually about 24 hours after your last smoke, and it decreases over days and months, so it's a long-term process. Nicotine stimulates the sympathetic nervous system. It gives you increased heart rate, blood pressure, oxygen consumption, and it causes the gastric muscles to contract. So I think we're about out of time. All the reasons you should stop smoking. And Berger's disease, even though it's not terribly common, I wanted to talk about it because it is a disease that you may get if you're smoking. You definitely will not get it if you're a non-smoker. So better to stop smoking. So I put in my little pitch. I'll close it here, and we're going to go into autoimmune disorders and immunodeficiency disorders next time. So please join me then.